Devastating impact of alcohol abuse, particularly on younger people and families. Tolashe is calling for action against selling alcohol to minors as we face rising numbers of deaths related to alcohol and violence and teenage pregnancy. Newzroom Africa's Nobuhle Modise joins us live now from Pietermaritzburg. Nobuhle, good morning to you. What are we expecting there today?
A very good morning, Stephen. I'm coming to you live from Sweetwaters in Pietermaritzburg, where the Department of Social Development is, reflecting on World No Alcohol Day. And we know that the department refers to alcohol as the most misused legal drug in the country. And stats also indicate that, Stephen. We also know that here in this particular area, why they've identified it as one of those areas where they wanted to come and reflect on the day and to raise awareness on the misuse of alcohol is because of the high levels of crime in this particular area. We know that there's high GBV rates as well, and just crimes amongst youth who are misusing alcohol. But I do have with me Lumka Oliphant, who is the acting director general at the Department of Social Development. She can take us through why we are here today and what the program is going to be. Thank you very much, Ms. Oliphant. Speak to us about what the program of the day is and why we are here.
Firstly, October is Social Development Month. Therefore, in this month, we come and raise all the services that social development is offering, and we go to communities. But most importantly, yesterday was World No Alcohol Day, World No Alcohol Day, and that means that we have to commemorate the day in terms of making sure that communities in South Africa understand the dangers of alcohol. As you have said in your intro, that alcohol is the most misused legal drug. When we say that alcohol in the country is not prohibited, but because it's not prohibited, people tend to misuse it, and also because of our past in South Africa and how alcohol, was also used. So as the department, we are responsible for making sure that we have prevention programs. We're making sure that people are aware of the dangers of alcohol, and also, most importantly, trying to say to South Africa, if we can't, at least for this month, not drink, so that we can see how and where we can go to as a country. We have issued a statement from the minister asking and appealing to South Africans if we cannot just try and see if we can't abstain. Most importantly, again, is that we have an issue of adults, selling alcohol to children, and we are also coming here to raise that and to say that it is illegal to sell alcohol to children. And we are trying to also assist families. The minister had said in the beginning of the year, one of the things that she wants to champion is the strengthening of families, because she believes that when families are strengthened, everything comes from the family. That parents shouldn't also send children to buy alcohol. Parents also should try and not drink in front of children, so that we try and make our children understand the dangers of alcohol. We come from a very difficult tragedy in the Eastern Cape in Nyobeni when children died, and therefore we are trying to make sure as the department and as the government to make sure that these things don't happen again by giving people information, by making sure that the laws are strengthened, by making sure that we give the necessary information to families, and importantly children. When we speak to children as well, children tell us that they are worried about parents who drink. They tell us that they understand that their parents have multiple challenges, and they tend to go into alcohol to make sure that they don't deal with their issues. So that's why we are here, and the entire month of October we will be in communities speaking about different things around the country. Next week we'll be talking nutrition, because in the country we are supposed as well to make sure that we reduce the burden of disease. The other week we'll be talking NPOs, where we are going to be going around and making sure that NPOs, they comply with the NPO Act. We may be giving money to NPOs and supporting NPOs, but we have a high level of NPOs who are not compliant, and therefore we need to also take out the country out of the grey list, that, as you know, that we were grey listed, and NPOs were identified as one of the measures that can be used for terror financing. So this is what we are doing here in October as it is Social Development Month.
And then, Lumka, just to track back on the issue of children, I know that the department is examining the risk of the proliferation of non-alcoholic products onto the market. Speak to us about what this, also means.
Yes, we last year we had a global alcohol policy conference where we were looking at different angles and how we can be able to see what the industry is doing in terms of trying to get children to be in alcohol at a very young age. If you're walking into any retail store, you will see a number of 0% alcohol beverages. When we are coming from that conference, academics, paper after paper, were also cautioning us as countries now that the industry has gone out to make sure that they circumvent all the other policies that countries are busy doing. And the World Health Organization has also asked countries to make sure that as we are developing policy around alcohol, we must make sure that we look at these 0% alcohol beverages as a means that is used by the alcohol industry to get children into drinking at an early age.
And then, Lumka, just before I let you go, let's speak about the burden alcohol use has on the health sector.
Not just only the health sector, just for government. In terms of investigations on alcohol-related accidents, health, in terms of the crime that leads to people to be in hospitals, for social development, when parents die, it also leaves children orphaned, and that means that those children must be looked after by government. We are also trying now to move away from communicating just mostly on placing the burden on people, but also educating people on the health issues that come with alcohol, which was also one of the things that we were asked to do at the conference, that we must be making sure that we stress the harms of alcohol, and people must be able to understand